So welcome po sa ating pong, welcome sa Forever Healthy Products Incorporated. My name is Paul Vivo and I will be your host this afternoon. And we'll be having a topic, symptoms, care, and natural approach to autism by Dr. Mario Ramirez.
Okay, good afternoon po, especially for those who gave their time today to attend Dr. Mario's live lecture on autism. I am together also with us is one of our board of directors, Mr. Eric Garcia. Sir, joining us in Zoom, we have our CEO, Dr. Susan Barlin, and Sir Leon Katz. Po sa nasa Zoom, maraming salamat po sa inyong oras. I think you are 90 plus in Zoom right now. Yes. Thank you very much for supporting the cause. Okay? So allow me to introduce to you our program for today. The company's name is Forever Healthy Products. This is a live lecture on autism. This is our first for this year. And this is conducted by no other than our project, the director, Dr. Mario Ramirez. Okay, so this is a corporate social response to event dedicated to autistic and their autistic children and their families. Okay, so yun po ang focus natin ngayon. Okay, so just an introduction. Now, autism is a developmental disorder of variable severity that is characterized by difficulty in social interaction and communication, and by restricted or repetitive patterns of thought and behavior. Okay, families of those on the autism spectrum experience their own trials. I myself po, ang aking panganay po, special child rin po. No? Ang case niya is Mobius syndrome. So alam ko yung hirap ng pamilya, no, na merong anak or within the family that has this kind of mabigat po. Lalo na kung kakapa kayo dyan. So that's our objective right now is basically through the clinical studies that Dr. Mario has done, i-share niya po sa kanya mga cases na na-handle niya. Okay? So a child with ASD can be challenging. They may be restless, have trouble sleeping, eating, or speaking, experience seizures or have meltdowns born of frustration or overstimulation. Okay. Expectations for a normal life may need to be adjusted. It takes time to develop the patients to cope with ASD behaviors, such as hours of watching the same video, endless jumping or twirling, or inexplicable fears. Therapies and interventions may replace play dates. So early intervention gives children with ASD a better chance to develop social and other skills, but it may be a struggle to schedule the necessary evaluations and to decide how to diagnose and treat co-occurring mental health disorders such as attention deficit hyperactivity disorder or ADHD, obsessive compulsive disorder, OCD, anxiety, and depression. Now, from the website of World Health Organization, let's look at some key facts. Autism, also referred as autism spectrum disorder, constitutes a diverse group of conditions related to the developmental of the brain. Now, about 1 in 100 has autism. If 1 is 1 over 100, that's 10%. Okay? Now, characteristics may be detected in early childhood, but autism is often not diagnosed until much later. The abilities and needs of autistic people vary and can evolve over time, while some people with autism can live independently, others have severe disabilities and require the lifelong care and support. Evidence-based psychosocial interventions can improve communications and social skills with a positive impact on the well-being and quality of life of both autistic people and their caregivers. care for people with autism needs to be accompanied by actions at community and societal levels for greater accessibility, inclusivity, and support. And I would like to comment, by the way, right, some of you, naka-meet ko kanina, no, yung mga SPED teachers. Okay, I commend you for doing your work to help these people, and especially those po sa Zoom. Alam ko, yung mga nag-register kasi some texted me, some are SPED teachers. Congratulations po sa inyo lahat. Okay, so now, allow me to introduce to you our company. Who are we? We are the leading company that advocates good health, starts and ends at the DNA level. Okay, so base po doon sa mga studies na ginawa ni Dr. Mario, ito po yung ating i-present ngayon. Ano? We are the exclusive global distributor of Immunogen products. Agricultural food supplement, backed by science, is the 1950s and Eastern Europe's best kept health secret. Okay. Now let's learn more about the founders. Let's start with Dr. Susan Barlin. She is in the US right now. Actually, she's attending in Zoom. Mamaya pagsalitain po natin siya. A visionary, she's a catalyst. She's a game changer. She's our CEO, co-founder of CEO Clubs Philippines. She is an international marketer. She is an executive director of John Maxwell Kim, former special envoy for investment in tourism. She was once connected with our government. Okay, so to learn more about her, let's watch this short video.
One word to describe her is incredible. Down to earth, approachable, humorous, and full of life. That is how many people describe Susan Barlin. Her life is full of adventures. Her experiences are wide and deep. She had her hands on many industries like global trade, marketing, investment and international real estate sales and concept development. She had always been an entrepreneur and a people person with an endearing soul. She started to dedicate herself to advocacy that is bigger than profit, but full of meaning. After all, it only takes a big burning desire and commitment, plus the heart to make a difference. This is what she lives for right now, and she believes that she had found the answer and vehicle for her dream to finally come true. It is not easy way, but she accepts the challenges. She is described as a visionary catalyst, game changer, and advocate of Zero Poverty 2030.
Okay, before I call on her, allow me to introduce
He is the incredible president of Forever Healthy Products, LLC. A driven, out-of-the-box, hands-on, hardworking, strong-willed but compassionate person. He is the successful entrepreneur behind Forever Healthy Products. Through persistence, consistency and hard work he learned a lot about success and failures. These lead him to develop values in business and determined to bring the company to success. As he says, success has a high price and does not come easy. His advocacy on livelihood was born after spending a lot of time in Asia. He vowed that any business he will be embracing will have to include an opportunity for those who has dreams that would almost be impossible to realize.
May we call on our the CEO, Dr. Susan Barlin, and our President, Sir Leon Katz. Good evening, Ma'am Susan. Good evening, Sir Leon.
Good evening, Francis. Good evening to everyone. I'm really very happy that the event is very well attended, and that I can guarantee you that you guys are going to learn a lot of things and discover something that you or a friend or somebody in the future you will meet who is experiencing the sadness of this disease. The there is hope. There is something that's natural, and we can help many people. And I hope that each one of you can be a bridge to enlighten the darkness in the lives of these people who are afflicted with autism. And I thank Dr. Mario, whose heart is really in this subject, and of course our president, who really is very dedicated to help the autistic people and children. So God bless us all, and I am telling as I always say, God's hand is on this product, because there are so many children right now suffering from autism, and including our grandchildren, and Leon will tell you the story about his grandchildren. So God bless us all. Thank you, guys.
Thank you very much, Dr. Susan Barlin. Sir Leon, good evening, Sir Leon. I know it's late there in the U.S. right now.
Yeah, good morning, good evening, everybody. It's really a privilege and an honor for me to speak to this large group today. And first, I want to thank the parents and the family members who have to deal with and take care of a family with someone afflicted with autism. It's not easy. They are the real heroes, not us. They are the heroes. And you may have seen in a few of the videos earlier some of the struggles and what they go through. We're just happy that we can be and we are part of the solution. And I also want to, in addition to the families, I want to thank the good doctors who are part of the community helping these children and families that have the conditions, because it's very specialized. Autistic children are different. And the information that they are given is sometimes not adequate. I also want to thank the good doctors involved with the company, like Dr. Mario Ramirez, who, good 6 years ago, started with me to come up with a solution and things we can do to help the autistic family solution. And Dr. Arlie Imperio, similar with public health, interested in the public health of people, in addition to being a great, incredible MD. And Dr. Jose Oclarit, who was actually last year nominated for the Nobel Prize, but it's a long story. He isn't the winner, but he was nominated because of his work and what he does and how he contributes to the medical professionals around the globe. So what I'd like to say, or ask the question, what is our goal? Our goal is a simple goal. It's to bring good health and opportunity and share it with people all around the world. What's interesting is, like Susan said, our product is really an incredible product. It's a natural product. And some years ago, when we embarked upon helping the children, we have many stories about families who have benefited, like the few that we showed the videos. And for me, I have a personal adventure to talk about. I have 2 grandchildren who are autistic. And what often happens in the case of autism, the children are out of control. They don't know how to express themselves. They cannot communicate. They cannot let the parents or people know how they're feeling, what they're thinking, what they want to do. And it causes a lot of frustration and sometimes a lot of hostility. My 2 grandchildren, when they from the beginning, they were very hostile. So the mother had a terrible, difficult time and challenge in trying to get them to do what needed to be done and get them to understand or sit down and eat or listen or get dressed or get ready. But their lives are totally different. And with them being different, like the one lady, Sophia, said, her son was totally different now. And the same thing with Sean's mother and Beho's mother. We're very blessed and we're hearing all these incredible, great stories about how the lives of the children have changed, and even some are actually adults at this point, 30 years old, 20 years old, like Sean was 19 and now he's 4 or 5 years older. But everything is different. My grandchildren, they're now going to school. They come and visit me. On Wednesday a week ago, they came and visited with me. And what did they do? We went to Venice Beach, went shopping, went to buy clothes for them because school pictures were the following day. So they wanted to look good and they wanted a new long sleeve shirt. So that's what we did. We went shopping to buy them some long sleeve shirts so they could look great in their school pictures. So we have many blessings like that. And for those who are already taking the product and sharing with their children, they know it's true. There's absolutely no hype, no stories, no make-believe, no advertising. It's just what happened. And the videos that you saw were just people expressing and telling you what happened. So you're going to hear a lot more today. It's my hope that those family members who are not currently trying the product, that they do it. Just like Sophia said, try the product, see what it does. Just like for my grandchildren, just like Sean, just like the Bejo family. Lots of stories. So be part of the success. Try the product. We know what happens. We've seen it over and over again. Today we're focusing on autism, but it's much deeper than that because it doesn't matter what condition you have. It doesn't matter what you might need. This product will help repair and restore and regenerate at the DNA level. So listen up, get a pencil and paper, take notes, and try the product. Thank the person who invited you. And after this presentation, you may want to call them, talk with them, or be with them. So God bless. Thank you so much. Francis, it's yours.
Okay, thank you very much, Sir Leon. Okay, let me just go back again, sharing the slide. Okay, so today's topic will be focusing on the symptoms, care, and natural approach to autism. Okay, so again, this is headed by our project director, Dr. Mario Ramirez. Okay, so let's learn more about the background of Dr. Mario Ramirez.
Dr. Mario Ramirez is an orthopedic surgeon at the Philippine Orthopedic Center. Finished top of the class at the University of the Philippines, Philippine General Hospital, Institute of Public Health. Head of Dengue and Dietary Nucleotide Study. And also the head of clinical study dietary nucleotide in children with neurodevelopmental disorders and autism. Dr. Mario is a member of International Society for Nutrigenomic Nutrigenetics, member of World Society of Anti-Aging Medicine, and also a member of Institute of Functional Medicine.
He knows what life is and how to save it. A lot of things happen along the way, but he was able to handle everything. His family is his loyal friend. They are always together. He has a lot of experience.
To give us an overview of today's topic, I would like to call on one of our medical consultants, Dr. Arlie Imperio. Dr. Arlie is Dr. Arlie.
Thank you, Francis, and good day to everyone. Good evening, America. Good afternoon here in Asia. So I saw the importance of autism when I was talking to one patient, a mother who had 2 autistic child, and she narrated to me the challenges that they had as a couple. But what caught my attention is that she privately confessed to me that she was about to commit suicide with the difficult experiences which she had with her 2 autistic children. And she was inside the comfort room. The husband noticed that she is not getting out, so the husband banged the door, And when the husband entered the comfort room, she was about to hang herself. So she told me that's how difficult having a child with autism, because she had two. And the good news is that she was crying because, you know, in truth, and Dr. Mario will be giving us the details, in truth, autistic disability or as a problem is genetic. So actually there is no cure because it's genetic. It's already there. But the good news is that through epigenetic medicine, we can improve the function of the DNA to cope with the problem. So we call that the phenotypic expression, and Dr. Mari will give us the details. So we have the genes, that's what we inherited, but the expression of the genes can be improved. We call this in medicine adjunctive support treatment. So the key question is there still something that we can do? And the good news is that Dr. Mario did some research starting in Cagayan de Oro involving about 100 autistic children. And by simply adding some improvement in their nutritional support together with the doctor, there was significant improvement. That to this mother that I was talking, she was so happy because after so many years, they cannot sleep well. The child's behavior was better. Of course, the problem is still there, but that improvement already meant a lot because it almost cost the life of the mother. So let us welcome our speaker today. His credentials were already given, but let me add a personal, let's say, note. When our dear President, President Erap Estrada, had his surgery in Hong Kong, and his orthopedic surgeon is from America. Do you know who is the backup surgeon? Just in case an orthopedic surgeon is needed, it is Dr. Mario Ramirez. So let us welcome Dr. Mario.
Thank you, Dr. Harley. I'm Dr. Mario Ramirez. I'm an orthopedic surgeon. So let me just explain to you how everything and how my studies on autism became my advocacy. Right. So in I think it was 2017. I had a patient who was, I'm an orthopedic surgeon, who was a CP, cerebral palsy, spastic cerebral palsy. So the physical therapies and the rehab doctor was having a difficult time managing the patient because the patient was violent, spastic, uncooperative. So they were saying he will not improve. Nothing can be done for him. Walang magagawa. So what I did was, because I was with already Emergen, and I've been using Emergen for a lot of people already, albeit elderly, older people. I tried using it for younger people, individuals, okay? Individuals particularly with neurodevelopmental disorders. And we found out that with the CP patient that I had, that there was increase in the mood. He was calmer, easier to manage, and the rehab went very well. I don't know why there's Francis, there's an echo. Yeah, the rehab went very well. And when that happened, the doctor, the mother, and the physical therapists were very, very happy because number one, not only was the patient improving sense of the physical therapy aspect of it, but in terms of the social, mental, and mood, emotional aspect of it, the patient, according to the mother, was also improving. So that started the what if, and there are things in our life that we have to do the what if. What if I married my first girlfriend? What could have happened? What if I did not marry my wife? What could have happened? But these are the what ifs that will be difficult if you do not try it, right? So I told Sir Leon, we have to expand the problem. We have to expand the study, try to find out whether this can be used in patients with neurodevelopmental disorders and autism. And what we did was, I was stationed in Cagayan de Oro that time. And what we did was to coordinate with the school. So that school had 15 patients. The 15 patients that we started with, they said, okay, we'll give you the diethyl supplement in Neurogen. And of the 15 patients, there was only one that failed to finish the study because I think they left for another province. So of the 14 that continued, all of them had improvements in mood, learning, particularly in the mood because they were easy to manage. Sleep, the patients were not being so difficult to manage in terms of sleep. And learning ability, they were able to learn. And I will show you some of the patients right now. And one of my favorite is Sean. Sean, when I saw him, he was 18 years old when he first went and I saw him. He was very violent. He was actually, the mother will explain later with the video that I'm going to show you. Sean cannot tolerate sitting down for 5 minutes. The first time before taking Immunogen, he cannot tolerate sitting down. But after 1 month, you can see that he was sitting down and watching me and smiling as if he understood my lecture on autism for 1 hour. Oh, wow. I was so impressed that we then continued on until we had 20, then 30 in Cagayan de Oro. We went to Manila, went to schools in Parañaque. I forgot the name of the school in Parañaque. And we extended also the study not only in the Philippines, but we went to Malaysia. In KL, it was so successful that there were people coming from different areas of Southeast Asia. I was asked to talk in Brunei, and we had patients in Brunei. I was asked to talk in Singapore as well as in Indonesia. And now we're in all these countries. And as a matter of fact, within the next few weeks, few days, I will be traveling to Singapore to talk to the foundation, who is the one responsible for donating to autistic schools and autistic societies for the whole of Singapore. Right? So that's how the advocacy started. And you cannot give me 1 million pesos to tell me you do not give this to patients. Do not give this to autistic children, because there are autistic children right now who, and you will see it with the videos I will be showing you, who are considerably well off right now in terms of social, emotional, and their ability to be able to learn and integrate more in society. If that is not a good reason for me to endorse and become an advocate for autism, for improvement in autistic children, I don't know what is. Right? So let's go start on. Some of the lectures can be technical, but we'll try to skim through it and make it easier. Francis, can you click the play button? Doon sa picture itself. No, the picture itself. Click the picture itself, yes. So, as you can see, I'm an orthopedic surgeon. I've had a lot of trainings in trauma, arthroscopy, and hip and knee. I'm also recently a fellow for the International College of Robotic Surgeons, so I can do robotic surgery already. Well, I can do the surgery, for example, here. and the patient is in San Francisco. Right. And I get paid in dollars, right? Good, you know? So I'm also a member of the Institute of Functional Medicine because right now there are things that conventional medicines cannot address. And it's funny because one of the things that, because being an orthopedic surgeon, a lot of my patients come in with arthritis, right? The more you are in pain, the happier I am. Yeah, because the more pain you are, the more desperate are you going to be. And I tell you, let's operate on your knee, like Erap Estrada. Erap Estrada paid 7 million for one knee. 7 million pesos for one knee. Operated at 14 million. We did not pay for it. We paid for it through the government. So when you're in pain, it's very difficult not to say no. When I tell them, my patients, let's operate. Okay, we operate. How much do I need? We need 1 million pesos. All right, let's do it more. 1 million, half of that goes into my pocket. Then after a while, you know, there will come a time that there has to be something else. Being an orthopedic surgeon, when a patient comes to you and says, Dr. Ramirez, I've been a loyal patient of yours for the past 10 years. When I started, I had arthritis on my right knee. Now, after 10 years, I have arthritis on the left knee. Then she asked me, what else can you do for me? If I tell you, and you are my patient, if I tell you there's nothing else I can do for you, will you still stay with me? Huh? What will you do? Look for somebody else, right? And it's exactly the same with autistic patients. If there's nothing else we can do for you, you look for something else. And I went from conventional medicine into functional medicine. I was part of the GATE studies from San Francisco, the glucosamine arthritis intervention studies. It was a big study, and the study I was part of, which it was in San Francisco, and that big group of studies showed that the glucosamine sulfate is as effective as naproxen in terms of relieving pain for patients with moderate arthritis. All right? So now that is how I got into functional medicine. I'm also into nutrigenomics, and genetics, the influence of food in our genes, and also I'm also a member of the World Society of Anti-Aging Medicine. Diba? Nobody wants to age, right?
Yes. You look very young.
The reason I'm very young because I was born at a very early age. Yeah. So that's Sean. That Sean, when he first came to me, he was not able to talk that much. Make sentences. He can just say food. Short. I will show you more later on. Next slide. So let me show you a short video about what's happening with patients with autism. Next.
Autism, also known as autism spectrum disorder, is characterized by symptoms that include impairments in social communication and interaction, and restricted and repetitive behaviors. Although the neuroscience of autism is still poorly understood, autism is considered to be a complex developmental disorder that involves atypical brain organization starting early in development. Individuals with autism often experience a period of unusually rapid brain growth in infancy and early childhood. This accelerated brain growth is linked to an atypical pattern of connectivity between brain regions. A number of studies report that alterations in brain circuitry involved with social interaction and attention can be detected well before the symptoms of autism begin to appear. At this point, however, it's unclear how brain overgrowth and atypical connectivity might be linked to the occurrence of autism symptoms. Research suggests that the risk of autism is strongly influenced by genetics, yet studies consistently report that environmental factors also play a large role. Although a number of potential environmental factors have been identified, the risk factors for autism are far from definitive, and it remains unclear which factors are responsible for causing an increase in autism risk and which are associated in a non-causal way. The risk factors that are most strongly linked to autism are associated with the prenatal or perinatal period. Thus, it's possible they might be responsible for disruptions to typical neural development, leading to symptoms of autism months or years later. How these risk factors might interfere with neural development is still uncertain, but hypotheses have suggested potential mechanisms such as epigenetic effects, inflammation, oxidative stress, or damage caused by oxygen deficiency. More work needs to be done, however, to fully elucidate the genetic and environmental risk factors for autism, as well as the mechanisms for the development of autism symptoms.
There have been a lot of studies regarding autism, but there is no definitive diagnosis of what it causes. But suffice it to say that a lot of the patients who had autistic children had in one way or another a problem with birth trauma, cerebral anoxia, or hypoxia, or the lack of oxygen in the brain of the infant as he was being delivered, was one of the causes that could be potentially the reason why patients develop autism. But there are also what we call the epigenetic, which are the psychosocial, the emotional, the food. These are epigenetic beyond the genes. And the most current research right now is that there is a genetic preponderance, as I will show you later on with next slide, please, with the next few slides. It was Dr. Leo, PhD at Keener, who said the use of autism. Before that, it was being used, autism was being used as correlated to schizophrenia. But it was Keener who said, no, this is for children's disorder. Autism, he used it for children's disorder. And there is an incidence about 1 to 68 per population, 30% increase from 2012 to 2014. Then right now it's higher. I will show you later. There's a higher incidence in male compared to females. So they're saying that it could be a genetic preponderance, particularly with the Y chromosome, because males are XY. Females are XX. The other X could mitigate the influence of the Y. That's why XX would be less in terms of being predisposed to autism. Siblings, there increased prevalence, increased risk in twins. The Behos are twin, they have increased prevalence. Next slide. So the different genes for boys and for girls, they say that the multiple genetic effects could have a contribution in patients with autism. Biologic differences, as we said, more in males than in females. And that's because of the XY in males than the XX. There are different kinds of autistic phenotypic differentiation according to the genome. They say, and most of the study confirm that the defect in autistic patient is in chromosome number 7, but there are others that says it's in 3, 4, and 11. But most of the studies said that there are defects in chromosome number 7. Just like in chromosome 21, trisomy of chromosome 21 leads to Down syndrome. Here, they're saying it's a defect in chromosome 7. Next slide. So autism is a developmental disorder. There are problems with the way the brain processes information. So nagkakagulo-gulo. It gets jumbled up. And the main categories where they have difficulty are in social skills, communication, and in ritualistic behavior. Nakikita mo may ritualistic. They call it stimming. knocking of the head, bobbing, diba? Tapping, meron pa nga yung hand clasping, diba? These are ritualistic behavior. I will show you a lot of studies on why this is happening. Next slide. So the operational definition of autism, according to Powers in 1989 and confirmed again in 2000, they said that it is a physical disorder of the brain. All right, what has caused the tangle or the inability of one neurite to send signal to this brain where it is important to receive that signal, and it causes a lifelong developmental disorder. And I know as parents that you have struggled with, and as teachers you have struggled with some of these problems. And I feel you, okay? Just as a lot of my patients, a lot of the parents of my patients, they actually, how can I say, I'm so thankful because number one is that coming to me, I have a patient who is very well known, comes to me, operates on totally both knees, paid me a lot of time, but it will not be as good as a patient coming for me and saying to me, Dr. Ramirez, thank you so much because of you. You have improved the quality of my family's life and the quality of Sean. You cannot pay me 1 million pesos for that alone. Maybe 2 million, pwede ba? Next slide. So the primary symptoms are, number one, there is a communication problem. 40% are mute, they're nonverbal, they're praxic. There are a lot of differences. There's also problems with social interaction, particularly forming relationships. They cannot form relationships. Stereotypical behavior like the ritualistic, the steaming, the bobbing, the head bobbing. It is a form of being in control. It's parang sameness na, di ba? This is what I do. That's why they bob their head. They repeatedly do ritualistic behaviors. Abnormal sensory response, they could either be hypersensitive or hyposensitive, no? And it is definitely present in birth, thus pointing to the hypoxia or birth problems during the time that it was diagnosed. Next slide. So autism is a lifelong disorder. There's a lot of research that says that it is a problem in the DNA. All right? Although we do not know exactly yet, but there are definitely signs that it is a genetic problem because they did, it's not here, the next slide. No. They did a clinical study of 50 academic institutes which analyzes 100 or 1,600 families with children who have autism. They found out that there are a group that focuses on the genetic information, that there is a problem in the chromosome 11 of this family. So it is inherited from relatives. So they did this. This is an autism genomic project. It was done in, I think it was done in 2005. This was the report in 2007. Next slide. So the recent breakthroughs is that a lot of genetic problems are because of the use of pesticides. Polychlorinated biphenyls. In Malaysia, where I did the study, there was a problem in Tawau where their incidence of autism is higher than the rest of Malaysia. And when we started to trace the problem is that there was a big palm producing company by Saindarwi in Malaysia. All right, and initially they were using pesticides then, but they stopped already. And the pesticides went into the water tables, and when the water tables supply the water of the town. That is why there are higher incidence of autistic children because of the polychlorinated biphenyls. They are also found in some of the consumer groups, like in plastics and electronics. Okay, all right. So it disrupts the neural connection patterns. The pesticides, they disrupt the connection patterns. And the exposure and overabundance of leads to overabundance of the dendrites. So the connection of the nerves are called the dendrites. And there are disruptions in the neural connection patterns. These are the results of the polychlorinated biphenyls of the PCBs. Next. So the other risk factors for patients who are in increased risk of autism spectrum disorder are parental age. All right. So they say that it is the major risk factor, parental age, whereas Downs is with maternal age. All right. Autism is with parental age. All right. Did you get that right? Downs is correlated with maternal age. The higher the age of the mother when she was pregnant, there are higher possibility of Down syndrome. But here, the higher the age of the father, there's a higher possibility of the baby becoming autistic. So children of men over 40, there's a significantly higher risk compared to those who are 30. It's the ones above 40 are 6 times greater of having autistic children compared to those who are 30 and below. Older mothers are not associated with autistic. So, ayan, clear na yung mga mothers. No? Hindi sa inyo yan. Dahil sa tatay yan. Kaya ako ganito kasi sa tatay ko. Alright? So, the question now is that there could be a problem with spontaneous mutation of the sperm during the time of implantation in the female ovum. Yun ang rason. So it's still theoretical. They haven't really addressed that problem yet. So the only thing in mothers that had an effect on children is the use of mothers of antidepressant during the time that they were pregnant. So, kung hindi ka naman umiinom ng antidepressant, it's no problem. So, next slide. Correlation with vaccination. There are a lot of people who are saying the reason why my patient became, my son became autistic because of the vaccination. There was an extensive, very big control study, particularly in a Danish control study, where they used there was no link between thimerosal, which is the stabilizer for the vaccine, and autism. No link. But they stopped using thimerosal already, and even then, there was no decline in the incidence of autism. Basically, there was actually an increased incidence. So, since thimerosal was not being used in vaccines anymore, there was still higher incidence of autism every year. Right? So, it is the problem that non-vaccinated children becomes more prone to viruses. Next slide. So, genetic, we are saying that it's because of the father. Autosomal dominant, because it's X coming from the father. It's sex-linked, XY. It is the environmental factors are the pollutants, the pesticides, the toxins, trauma, birth trauma, particularly cerebral anoxia, food, diet, we will talk about that later on, radiation, lead poisoning is also a very high possibility, chemicals in the groundwater, which I was saying the polychlorinated biphenyls, which goes to the groundwater, and the groundwater is the one supplying the water supply in the town. And other factors are the multifactorial inheritance. You know, a lot of things in the environment and the possible genetic factor. Next slide. So, the signs you can see here. Number one is that the patient prefers to be alone. does not respond to the mother. There are troubles with interpreting. You know this. There are troubles with interpreting other people's feelings. There are repetitive motions, avoiding eye contact, and one of the prominent is avoid eye contact. They do not look at you, right? And they are sensitive to loud noises, right? Next. Okay, this is a short video.
Alistair, hi. Are you driving? What a big kid. Hi everyone, this is Alistair's dad. The most important thing to remember is just because some of these signs exist in your child, that doesn't mean an automatic diagnosis for autism. However, the more these behaviors occur in your child, the more concerned you should be. The key here is consistency and frequency of these behaviors. So in this first example, it's pretty obvious. Some children will hand flap during early development, but as with all these signs, pay attention to how long the behaviors last. If the child grows out of these behaviors, generally around 3 years of age, there's not much to worry about. But with someone like Alistair, who hand flaps every day, there is cause for concern. This is one example of self-stimulation, or stimming as it is called, and it helps to calm children with autism. This second example can be confusing to some, as most people have at least attempted to walk on their tippy toes at some point in their life. Again, pay attention to how often the child does the behavior. Our 9-year-old son, who was diagnosed with autism, still walks on his tippy toes to this very day. This third example may seem alarming. However, as long as they bang their head on something soft, like this padded high chair, generally they'll be okay. As a form of stimming, it can help calm the child due to the rocking motion. Many people with autism like to rock back and forth. We also show Alistair banging his head on the glass door and on the ground to show you different examples. However, after recording the footage, we promptly removed Alistair from the situation and redirected his attention to avoid any potential damage. Some people even need to buy football helmets for their kids, it gets so bad. This fourth example may not seem so odd to parents and others. After all, hasn't every kid been fussy in public at some point? But this behavior has less to do with not getting a treat or a toy, but due to the loud, bright conditions of most public settings. While it may be hard to distinguish sensory fussiness or meltdowns from common temper tantrums, an easy way to tell is this. When you give your child what they want, do they stop the bad behavior? If so, it's probably them just throwing a typical tantrum. However, if they continue to fuss, scream, and cry, as if in pain, even after they get what they want, then it's probably a sensory-related tantrum or meltdown, as most people call it. Although I don't recommend giving into a child's demands, I think this exception can help once in a while, as it can be very revealing. Also, most common tantrums last minutes, whereas a sensory meltdown can last hours. Oh, buddy, I love you. Hard time, I know. We'll get you home, okay?
In this fifth example, we see another example of stimming. While every child loves to play with water and blow bubbles in their milk, the key here is, again, how long does this behavior last? Also, you may notice that your child is doing this behavior alone, withdrawn from others, instead of trying to put on a show. Generally, the behavior will last longer than 5 or 10 minutes and can last hours depending on the severity of autism. Look for extreme obsession and repetition with objects. At number 6, we have very aggressive behavior. All kids fight at some point. But is your child doing this immediately after being punished, as if they are enjoying it? It may seem odd, but this can be another form of stimulation, as they get a strong response from others when they are aggressive. You will notice the child being much more aggressive than a typical child for no obvious or good reason, like wanting something another child has, such as a toy.
Alistair, can you use your words? What do you think about the car wash?
At number 7, we have a lack of response to voice or sound. While every child has ignored their parents at some point, usually out of spite, you will notice an autistic child being aloof, as if in their own little world. Sometimes parents think their little child has hearing problems at first, but this has more to do with being withdrawn than not hearing. If anything, autistic people hear too much and have a hard time filtering out noises.
Alistair, what are you playing with there, bud? You playing with a car? No, listen, sit down. Alistair.
Alistair. Alistair. Alistair. Alistair, I'm talking to you. Number 8 is probably the most well-known sign, and that's the lack of eye contact. Most people with autism will avoid eye contact whenever they can, and many describe it as painful. While the specific reasons can vary from person to person, this is definitely a strong sign that autism is present and usually persists into adulthood. Number 9 is missing speech milestones. If you don't know the general rule for how many words your baby or toddler should be using, then it's only a quick internet search away. Generally, if your child is only using a few words at age 3, there is cause for concern. If your child is 4 or 5 and is still not using basic sentences, there is a great cause for concern. Also, echoing words, or echolalia, is when they constantly repeat the same phrase, not in a learning way, but more like a broken record way, again and again and again. So be aware of that too. It's been saying the same thing for the past 20 minutes, right? Finally, not all people with autism are nonverbal. Just because your child may be talking doesn't mean they're necessarily out of the woods. Number 10 has to do with problems in food or textures. Many people with autism are picky eaters, which ties them with the sensory issues. Some hate the feeling of yogurt or dislike their food touching other food. While this sounds like typical child behavior, it's on a much higher level. If you offer that food to your child, even if they are clearly hungry, they won't eat it even to save their lives. Fortunately, our son Alistair passes this test mostly. He loves all kinds of foods. He is much more picky with textures like clothing tags and scratchy shirts. Our older boys who have been diagnosed with autism still love to wear their clothes inside out to avoid clothing tags or odd textures. Alistair loves the feel of flannel and likes to wear hats for the feeling of security it gives him. While we didn't get to cover all the signs and symptoms of autism, we hope this gets you started in the right direction. If you seriously think someone you love has autism, please reach out to a local psychologist, neurologist, social worker, or other professional. The sooner you get your child help, the greater chance they will have adapting to society and its many social customs. On that same token, please continue to help those with autism by educating yourself and others about the conditions they face every day. Thanks for your time and best wishes.
So, the reason why I showed this is for you to know, and for those who are not conveniently aware of the problems of autism, like the tiptoeing. A lot of my patients, just recently, there was one patient who was brought to me because he was tiptoeing. So a lot of doctors were saying, there's a problem with the TA, tendon of Achilles, it's shortened. But I looked at it, it's not. Then tiptoeing is a sign of autism. So the point is that the earlier that you find that there are problems with your child and the earlier they are referred to a specialist, the better will be the outcome in terms of them being able to socially integrate into society. So we have levels of autism. I know you particularly know this. Number 1 is the high functioning autism, which is the level 1. High functioning, they need support, but not as much as the other kinds of autistic levels. They have barely noticeable behavioral patterns, unlike in autism, which is autism itself, level 2. And they have already they need significant support already, and severe autism, very, very high support is needed, which is level 3. Next. So the challenges to diagnosis is early diagnosis. A good observational analysis and tests and diagnosis is essential. Unfortunately, we do not have a standard medical blood exam or medical test that we can do and find out whether the patient is autistic. Unlike Down syndrome, we just do a chromosome assay and look at the chromosome, the trisomy of the chromosome 21, then we can say it's Down syndrome. Now, we rely on the behavior, the characteristics, the definition of a child who was autistic. Next. So we need to screen children with ASD at 18 and 24 months of age as a general wellness checkup. It is not being done routinely here, unfortunately, and even in the US, it's not being done. But we are already in the point that we are getting to understand more about autism. So estimated lifetime cost is about 3.2 million in terms of being able to manage an autistic child, a child with autism into adulthood. Early intervention, like I said, is very important. It should be before 3 years of age. And I will talk about intervention later on, what should be done early on, so that the process of you being able to, or the child with autism to be able to be integrated in society will be at a higher level. 80% of the children had missed intervention, unfortunately. And next slide. You know the cause. I mean, let's not talk about the cause anymore. Few pediatricians screen for ASD. Lack of familiarity, not only because from the doctors as well as from the teachers, from the parents themselves. And the one of the major reasons why ASD is diagnosed is because of the concern of the parents. It is the parents, not the doctor, who diagnose it. I mean, oh, my child has this one, his delayed development has this one. And it is only during then that we are able to diagnose, or the doctors are able to diagnose that the patient is autistic because of the concern of the parent. If the parent did not tell the doctor will not notice. Unfortunately, that's a sad fact. Had the doctor noticed, early intervention could have been done. If early intervention could be done, it would be easier for you, and your life as a parent of autistic child will be easier. Okay, next. So most referrals for ASD, according to the National Institute of Child Health and Human Development, there are 5 warning behaviors for ASD. Does not babble or coo at 12 months, right? You know this, right? When you have baby, and they blah back, right? There are no gestures like pointing, grasping, waving at 12 months. Does not say a single word by 16 months. And does not say 2-word phrases by 24 months. And has any loss of any language or social skills at any age. That means they are not able to form relationship. They cannot bond with the parent. They cannot bond with the sister. And this is already a lasting sign that there is a problem with your child. Next. So these are the developments, the areas that needs to be addressed, because these are the most problematic in these areas, which is the social skills, communication skills, and the ritualistic behaviors. Next slide. So 1 out of 10 people have autism. It could be genetic, it could be neurologic, polychlorinated biphenyls, the pesticides, and other forms of pesticides and pollutants, and possibly the lack of vitamin E, particularly in the mothers. All right, next. These are still questionable, but the only thing that they say right now that is sure, they call it, from autism, they call it the autism spectrum disorder, because they are spectrum. It is not one, you're autistic. Okay, that's it. No, this is spectrum. Like the level 1 is one level, or one end of the spectrum. The level 3 is a more severe end of the spectrum. So it could be different levels for different. It's not, you cannot say that when you're autistic, this is, this is what you have. Really, it's different from every autistic patient. Next slide. So I like this slide because it's a signs of autism. Signs is social interaction and verbal communication is impaired. That's the S. I is imagination. Ideas, creativity are reduced. G is gestures and non-verbal communications are limited. N, narrow range of interests and routines. Very, very common, repetitive disorder. They only do one particular thing. They always want to do that. And S, that's why signs, sensory responses are unusual. So easy to remember, signs. Next slide. All right, so again, we have here the early signs. Next slide, point. Let's not discuss this because I know you can Google it for children. Next slide. So the other names for autism is autism spectrum disorder, autism spectrum condition, Asperger's syndrome, pervasive developmental disorder. All right, these are different names for the same problem. Next slide. So throughout the years, the prevalence has increased. Okay, before they say it was 1 in 54, now it's about 1 in 44 children that's been diagnosed as autistic. Okay, higher and higher every year, and there are particularly high incidence of per country. Like in California, it's 1 in 26, while in South Korea, it's 1 in 38. Right, next. So social interaction. The problems are problems with body language, with sarcasm. They cannot convey something. Autistic children, autistic people cannot find it difficult to understand. Autistic people cannot maybe perceive as rude, okay, because you don't understand what they're feeling. The tone of voices does not always reflect how they feel. They sometimes shout because that's all they know. They shout. Autistic patients will be unable to gesture, and they will not understand idioms. Right? Next. Click. Autistic may find it difficult to instigate or join play. This is very common, particularly in groups. They find it difficult to take turns and share because they want it all for themselves. Developing and maintaining friendship, social relationships are very difficult. Do not engage in conversation in any way, particularly even with the mother and the parents. And they have very difficulty in understanding social relationships, social rules and regulations. Because sometimes I have patients who throw themselves in front of everybody, not because they want attention, it's just because that's what they do. Right, next. So how this impacts on daily life? Next, click. When problem solving, we rely on social imagination. This is difficult for autistic patients. Gameplay, teaming, playing as a team is difficult for autistic patients. They find it also difficult to interact, particularly if there are problems socially. Difficulty in creative imagination, difficulty in social imagination. That's why autistic people use calendars, planners to help them with their planning, with their social integration. Coping and changes are difficult for autistic patients because they like routine. So if you go out of the routine and suddenly change the idea or the plan, it's very difficult for them to integrate. Next slide. Okay. Sensory joy for certain colors. They love particular colors. All right, and they feel calmer in particular colors. They're more violent when they're exposed to different colors. So you have to find out what ano ba yun. And sensory joy, particularly for repetitive behavior, stimming, they call it. Decrease feeling of pain. Very, very important because sometimes they will hurt themselves if you do not check on them frequently because their pain thresholds are very, very high. So they have a decreased pain sensation. Sensitive to light in shops particularly. That's why they love dark places, dim places. Dislike certain colors. They also dislike noisy environment. They do not tolerate certain smells. I know you know this because there's one patient of mine, whenever he smells perfume, he really goes mad. Like violently mad, perfume. Anxiety in a particularly busy environment, and they're sensitive to touch. Sometimes you cannot touch them, right? Next. So be aware that autism has different experiences. As a patient, talk to the carer, seek advice from the others that are important things that you as a parent or a teacher should understand. Be understanding of people who are autistic, and consider how they can adapt to the environment by decreasing noise and decreasing the light and being more sensitive to their needs. Adapt also your communication style, because they need to communicate. You need to communicate with them better. Next. So how can we help? You help by speaking slowly and clearly to people who are potentially autistic. Do you understand? Allow time for the patient to process the information. All right. Sometimes they, kulang-kulang. Sometimes they get lost in translation. They do not understand. That's why they do not process the information very well. Avoid relying on gestures like, to us, that means, come here, right? But to them, that might be saying, I will spank you. I will hit you, right? So do not use idioms also, and keep instructions very short. All right? Thanks. Thank you. Next slide. We're almost done. Just a few more slides, and maybe about 10 minutes and 1 hour. Dim the light. Advise the individuals for quiet time. Be aware of background noises, particularly. Less stimulation is better for autistic children. Try to enable individuals with autism to utilize sensory equipment during activities, and I will be showing you some of the physical therapy techniques that are being used right now in the US. Next slide. So the natural approach to autism, we want natural approach because there are a lot of patients who are very medicated to the point that they cannot function, right? They're sleeping, unable to further integrate in society kasi talagang out of this world. Okay, so next. The autism diet. You know the diet, right? How many of you have heard the process of the autism diet? Alam niyo ba? Okay, let me show you. Number 1, you have to reduce gluten and casein. The gluten is a protein you get from wheat and other grains, like barley and rye. It is also one of the causes of major digestive problems. I will show you later on. I will talk about that later on. Casein is a protein you get from milk. So some patients, a lot of the patients particularly, will not tolerate, and when you give them more milk, they become more severe in terms of the autistic symptoms. So both gluten and casein are anti-inflammatory. That means it causes swelling. The more swelling, it could become a problem in an autistic child because they're very prone to inflammation. Researchers say that the peptides or the proteins in casein and gluten, they bind with opioid receptors in the brain. So when you give them gluten like wheat and casein like milk, they're like high. They're like an opioid. It's like giving them opioids, giving them heroin. They're sleepy, they're giddy, they're very aggressive, they seem to be zoning out, and they sometimes have self-abusive behavior. That's because of the diet. So be aware, gluten, so you have to have low gluten diet and low casein diet. So you just Google, You ask Professor Google, low gluten, what are the food that has high gluten? What are the food that has low casein? You know, what is good for, what is okay for children with autism and what is not okay, what food is okay. It's important. And one of the particular important study that is being done is in KL. They studied the effect of gluten in patients with autism. So they did one control study, regular diet, then one is low gluten, the other one is high gluten. And they did all these studies. They found that the ones with a high gluten diet had a higher incidence of autism symptoms compared to the autistic patients who are in control as well as the low gluten diet. Next slide. The other one is omega-3 fatty acids. Omega-3 fatty acids are the good fatty acids, right? We get this from fish oil. They say that it improves hyperactivity in children and also decreases repetitive disorder. This was published in a Journal of Child and Adolescent Psychopharmacology, and it also improves the social skills in children with autism spectrum disorder. Next slide. So here are the food that you can. These are the gluten-free, the food that is the green is the food that you can give. Avoid unless labeled gluten-free. You can Google this, you can find this at Google. Next slide. So probiotics, very important. What is the most common probiotics you know? Yakult. Yakult, okay. I bought stocks in Yakult already. Delight is also a probiotic. The Delight, yeah. There's another like similar to Yakult, it's another probiotic. There's also other probiotics in tablet or capsule forms. The Urcercurin is also a probiotic, and there are expensive probiotics in GNC. You can see it's more expensive compared to the right, And they say that the probiotic experience also increases the possibility of the children not having gastrointestinal symptoms. And I did a study on the gut and the brain. They call, I did a research in gut-brain barrier. But they say that the gut is your second brain. All right, whatever misfunction there is in the gut, it will affect your brain. And if you have good gut, it will give you, it will increase your happy hormone. So it will stimulate serotonin in the brain and it will make you happier. So good gut is important. And one of the products that is very essential, and you have to take this, is beta-glucan. I did extensive research on beta-glucan. The 1316, particularly beta-glucan, is very, very good because it feeds the good bacteria in your gut and helps balance the gut, what we call the gut microbiome. Okay, I've been a very ardent user of beta-glucan, particularly the Emergent beta-glucan that we have, and I did extensive research on it. Also, if you want, I can send you the study that I did on it. Next. So therapy. These are examples of the therapies that we are using. Next slide. The ABA. Physical therapy is important. Number one, it includes the activities, exercises. The important things that you have to understand is to build motor skills, improve and strengthen posture and balance, improve muscle control and strength. Then the other thing is speech therapy, which sometimes the mothers or parents will forget, because speech therapy is very important because it addresses the language and communication challenges of autistic children. Next. So occupational therapy is also is different. So how is occupational therapy different from physical therapy? Occupational therapy works to promote, maintain, and develop skills that are needed in social life, social integration. So it's different with physical therapy. Physical therapy is like improving muscle tone, getting you stretching, improving your ability to tolerate standing for long. Those are the physical therapy. Occupational does with social. How you can integrate in normal life. That's occupational. So self-care, how to take care of yourself when if the patient goes to the toilet. You use proper use of soap and water. These are occupational therapies. These are the things that the occupational therapies train or talk about. Even leisure, how to socialize with friends. Occupational therapies, and that's the reason for occupational therapy. So usually we start with a physical therapy. Then as a child, because that's important to have an early diagnosis, physical therapy, then language, speech therapy, then occupational therapy as the child goes into schooling already. Next. So there are tatlong therapies yun, no? So these are examples of the therapies, the ABA, not the band, but the Applied Behavioral Analysis. ABA is a science-based therapy wherein it focuses on teaching the necessary skills and stopping dangerous behaviors, right? And the other one is DIR, which is the floor time model, in which the therapy involves the parents playing with the child on the floor. Very effective because it's very, in terms of being able to the child and the mother to bond well. And I'll show you an example. Next slide with a video.
ABA therapy is a behavioral health treatment. It helps children, teens, and adults with autism spectrum disorders. It's beneficial because it teaches them the skills they need to have to be independent and have a meaningful life. Early intervention is very important. There's decades of research that support that starting early makes a big difference. Typically, patients need to undergo ABA therapy anywhere from a few months to a couple of years. It depends on each child and what that child needs. After diagnosis, we'll have the child and the family come in to do an ABA therapy evaluation. During this assessment, we will look at the child, we will assess their skill level, and with the parent input, we'll create meaningful goals for this child. And then 1 week after, this child will start ABA therapy. A typical day in ABA therapy consists of the child spending half of their time working on their independent goals, which are specific for that child. And then the rest of the time it's spent in group settings, where we have snack group, we have art group, we have music group, we have circle time. So they work on social skills that they need to be able to be successful in school. Some of the skills that can be taught and improved with ABA therapy are communication skills, toilet training skills, daily living skills, toothbrushing, getting dressed, communicating with others, taking turns, play skills, all kinds of skills can be taught through ABA therapy. We work on decreasing challenging behaviors while teaching functional skills. How do we do this? We break down these skills into small teachable units. For example, with toothbrushing, right? We will first teach the child to just look at the toothbrush and then tolerate the touch of the toothbrush and then tolerate the feeling of the toothbrush in their mouth. So these applies to all kinds of skills, language skills, social skills, play skills, every skill, right? And when the child masters these skills, it benefits not only the child, but also the family.
This is a new therapy, the ABA, and I don't know, it's already being used here in the Philippines. I'm pretty sure that you guys, once you Google ABA Philippines, and you can see a lot of therapy centers who are using it. If you want to learn more, maybe you just contact them. Next slide. I addressed I included this slide because these are the core autistic symptoms, which is the social deficit, the language, and the repetitive. All right, but outside of the core, we have associated neurologic problems like sleep deficit, mood problems, anxiety, hyperactivity, even immune system dysfunction, disorders, and sleep disorders, mood, anxiety, OCD, ACD. Seizures are particularly very prominent associated neurologic problem, seizures. And a lot of my patients are heavily medicated with phenobarbital, so they are very drowsy, sleepy, almost unable to function because of the problem with seizures, right? And I've done my research. Next slide. You can see that there is one component, we call it the adenosine, which is from the nucleotide adenine. Adenine is converted to adenosine. Adenosine can be used to address seizures because it's a seizure reducer. It's a sleep promoter. It's an anxiety. It decreases anxiety, and number one, and the third is that it decreases repetitive disorder. So if there is something that you want, you look for a product with adenine or adenosine in them. Okay, adenine is a nucleotide. Next. So we have researches done, particularly on the role of nucleotides in brain development, dietary nucleotides in neurodegenerative diseases. They say, next slide, the nucleotide inosine, which is a purine component in RNA, induces the growth of neurites in the brain. So this is a bit technical, but these are science-backed information that you need to know. All right, especially in the cortical infarcts, uridine is also pyrimidine in RNA, stimulates the growth and prevents the formation of tangles in the brain, right? Because there are neurons, neurites, they form tangles. Parang long hair, I used to have long hair, they form tangles, it's difficult. So you have to cut them already, right? And we call that pruning. Cerebral pruning. We prune the tangles from our brain. Next. The other things that are important to understand is that adenosine, again, confers neuroprotection against neurotoxic situations, especially for protection against the use of pesticides and exposure to insecticides from sprays. Next slide. The adenosine receptors in the synapse are induced by nucleotides. So the use of nucleotides increases the adenosine receptors and help prevent memory-associated loss of memory associated with neurodevelopmental or neurodegenerative diseases like senile dementia in adults. Right, next. So pathophysiology and role of purines and pyrimidines in neurodevelopment. Next, we see the next slide. There is increased gain in weight and head circumference of the brain because of the use of dietary nucleotides. Head growth is essential for baby, particularly in the critical period of brain growth, and it plays a part in the long-term cognitive development. So nucleotide chat. Next. It supports learning. Nucleotide supplemented milk formula encourages healthy cell growth in the brain. That is why, what do they always say? Breast milk is always the best milk, right? So sometimes I try to go down and look for breastfeeding mothers because milk pang kape lang po. Next slide. So another is that brain size and development is correlated, and the use of RNA nucleotide supplements can increase brain development, increase brain size, and increase the function of the brain. Next. So there is also, this one is a journal making a case of DNA repair in autism. Our body, in 2015, there was a Nobel Prize winner in chemistry that says that there are 3 repair mechanisms occurring in the body. And these repair mechanisms are the ones responsible for causing or removing the damaged DNA, particularly at the nucleotide level. There's mounting evidence that points that exposure of the DNA to damaging environmental, food, pollutants, is a major risk for the development of autism spectrum disorder. The study also identified genomic instability, meaning that there are studies that says that genomic instability, your genes are unstable, they're making you prone to damages to the genes, can cause defective DNA repair and sedative DNA damages, causing more ASD. These are more technical terms, but they are evidences that I want to point out. Next slide. So in conclusion, the patterns of DNA repair pathways are important in trying to remove or assess the susceptibility of the patient to autism. The role of DNA repair is very important in attenuating the autistic risk. Next. Brain repair, DNA repair in the brain, there are environmental pollutants, and the ones that are important is the nucleotide excision repair. One of the repair process that is that was promoted by the doctors who won the Nobel Prize for Chemistry in 2015. The other are the DNA repair mechanism, which includes base excision repair, nucleotide excision repair, and all these repair mechanisms are happening in the brain to attenuate or stop the development of the autistic patients. The only thing that they say, that the Nobel Prize said, that for the brain to be able to do these repair mechanisms, they have to have the nucleotides. Just as for you to be able to repair your house, you have to have laborers and materials, correct? The body has laborers in them. The only thing that the body not have, all the cells in the body are laborers. The red blood cell is a laborer that brings oxygen, nutrients, and water from outside of the cell to inside the cell when they are needed. Right? Your kidney and your liver are laborers that detoxifies and removes the pollutants in the body. Right? Your lung cells are laborers that brings oxygen, that absorbs oxygen from the environment into the lungs and brings it to the red blood cells, who are the ones responsible for transporting it, the laborer responsible for transporting it around or different parts of the body. Now, the reason why we get sick is because we have the laborers, but we do not have the materials. Right? Do you believe that God has given us the ability to heal ourselves? Right? Yes. But why do we get sick? Why do we get sick? We get sick because of Adam and Eve. Let me explain. By Adam and Eve, God said, do not eat this. What did Adam and Eve do? They ate the apple, right? The doctor says, do not eat this. And what do you do? Ngayon lang naman eh. It's only now. We have lechon here. We have ice cream. We have soft drinks, you know. It's the fiesta. It's only once in a year. But the doctor said, do not eat this. But you still eat it. Adam and Eve. Right? Sometimes it is things that we put in the body are the materials for our body to build. If you put junk in your body, would you expect good results in the body? No. Because you're using poor materials. You use second-hand materials for your house. That second-hand materials for your house will be easily damaged, right? You use good, sturdy materials so that your house will last longer. The same thing with our body. We use good, sturdy materials from the food that we are eating that is important to build our body's defenses, to build our body's ability to be able to repair the damages that is occurring every day because of daily life, daily activities of daily life. And that, my friends, is the reason why we get sick. And that is the reason why the doctors are rich. Because we want you to get sick. And do you notice that sometimes we do not give you things that will make you well? Because we want you to be sick. If you are
if you are well, do you go to our doctor?
That's between you and me. Okay? Not for everybody to know. So next slide. So that's just a few more videos and we're done.
We are all different, and that's wonderful. Some differences are easy to see. Height, hairstyle, gender, eye color, and so on. Other differences can't be seen. Our favorite foods, fears, or special skills. Interestingly, the way we see the world is also different. For instance, what do you see in this drawing? Most people see a duck, but some of you might have seen a rabbit. Whichever you saw, you are correct. This is just a trick drawing to show you that all brains work differently. The brain is your body's computer. It works differently for all of us and controls how you learn. That's why we are all good at different things. How you feel, which is why we all feel different emotions. And how you communicate. Sometimes the brain is connected in such a way it affects senses and how we perceive and read situations and interactions. This is known as autism. Many people have autism, so it's likely you already know someone who is autistic. And for this reason, it's useful to know a little bit about autism. The special wiring inside an autistic brain can sometimes make the person good at tasks we may find difficult, such as mathematics, drawing, or music. It can also do the opposite, and activities we find too easy are incredibly difficult to them, such as making friends. The senses constantly send information to your brain about your surroundings and other people. However, when a person's brain and its senses don't communicate well, the brain can become overwhelmed and confused, affecting how they see the world. Picture yourself walking down the street. This is how an autistic brain may experience the same walk. Scary, isn't it? Sadly, in many cases, the person can't say out loud how they feel. So even though there's chaos going on in their heads, they seem okay on the outside, unable to ask for help. We all develop behaviors to help us feel calm in uncomfortable situations. We may look away, hug ourselves, chew our fingernails, fidget, bite our lips, and so on. Equally, autistic people develop behaviors that help them cope with these intense moments. These actions may seem unusual, but they're just their way to feel calm. When they happen, it means they are having a hard time. The kind thing to do is not to give them an even harder time by getting cross, ignoring them, or mocking them. Remember, just because a PlayStation can't read an Xbox game, it doesn't mean it's broken. People with autism need friends who are willing to take the time to know them. With good communication and plenty of patience, everyone would be better off. People with autism are not ill or broken. They simply have a unique view of the world. And with a little support from their friends, they might just be able to share that view with us. Autism can make amazing things happen.
I love this video. I love this video so much. That especially the Xbox and the PlayStation thing. Even if the PlayStation cannot read the Xbox, it doesn't mean that they're broken, right? The same thing. We do not read the autistic patients. They're not broken. We just cannot, read the things that we usually can do. Right. Next slide.
we have a few more videos that maybe we can.
Was very irritable. He has lots of blank stares, seizures, and also he's got a lot of fears, especially when walking down the slopey area, and also going to the barber shop. He never goes there, and he even in the dentist, he never. For 19 years, because Sean is 19 years old now, for 19 years, 18 years to be exact, he never goes to the dentist. But after taking Immurogen, only 1 month after one bottle after taking Immurogen, I already observed a lot of things about Sean. His fears, he doesn't have any fears anymore. He is so confident already. He even asked me to go to the barber shop, and he's not afraid anymore. And also, he doesn't have any seizures, because before he always had these blank stares. He just keep on looking without any. He's so blank, and also his legs, he keeps on doing like that. But right now, no more. And also in school, he's so irritable. He keeps on throwing tantrums, throwing chairs before the classes will start. Then he keeps on shouting. Then he doesn't want me to go outside the room because he wants me to sit beside him doing his activities. But right now, he will tell me, "Mommy, you go out. You wait for me outside. I'll see you later." Independent. I asked him, "Really?" "Yeah, Mommy. You can wait outside." Immurogen really helped us a lot, especially me, because I don't wake up anymore.
Worried about him.
I'm not worried anymore, and I sleep well at night because he doesn't wake up at dawn playing or just staring. Even me, I'm so scared because when I wake up at 1 o'clock or 2 o'clock at dawn, he just keeps on like that, staring like that. When I ask him, he doesn't answer. So I don't sleep also, but right now I sleep well. Thank you. Say hi to Doctor.
Hi.
Hi, Doc.
Hi. Say goodbye to Dr. Mario.
Bye-bye. Bye-bye.
Didn't work either. Take care, everyone.
Ate?
Good morning, Sean. What are you doing? Tapo car. Wow. You always do this every morning, Sean? Yes, good boy, Sean. Wipe it properly. Wow. Sean really is a good boy. Say hi to Doc Mario. Say hi, Doc.
Hi, Doc Mario.
How are you?
How are you?
I'm good.
Doc.
Yes. Thanks, Sean.
Tomo nito mayo.
And one of the things that I really, really love about Sean is that they come from Balay-Balay in Mindanao. They had a problem financially because a single parent taking care of two kids who was during the time she had a daughter who was still in school. Now she has a daughter and a grandchild, single parent. So they were not able to buy Immurogen for a long period of time. But when with the study, we were able to give him Immurogen. And what happened was that despite the fact that they were only taking Immurogen for 3 months, the progression, what happened to the progression of the brain development did not regress. So the brain that developed proceeded developing. It did not regress. It did not become violent that he are able to integrate socially. So I'm very happy because one of the things that you have to understand is that if this works with patients, not only with Sean, there are a lot of patients, a lot of my patients had improvement despite the fact that they are unable to buy the dietary nucleotide Immurogen. Okay. So, meron po ba tayo? One more, next slide. There are still a few. This one is Luis. He is a 5-year-old autistic. When I first saw him, he was diagnosed as level 3 autism. Can you click the first slide on the left? On the left.
Sit down properly.
This is after 1 month of taking.
Hi, doctor.
How old are you? Later. I'll show you later.
Wait, sit down. Doctor is asking, how old are you?
I'm 5 years old.
Look at doctor.
I'm 5 years old.
Look at me.
Look at doctor.
I'm 5 years old.
5 years old. Then click the next slide.
Hey, what's your name? What's your name?
This one is illegal.
What's your name?
My name?
What?
Talk loudly.
Talk loud.
My name. Right. Doctor is asking, what's your name?
My name?
My name is... Stop eating. You talk first.
You look, you're so handsome, oh. Huh?
Okay.
How old are you? How old are you?
Preoccupied siya sa video daw.
Okay.
Then the next. This was the 1 month after taking the brain.
Say goodbye to Doctor. Saan tayo uuwi yan?
Thank you. Thank you, doctor.
Next slide. And finally, 2 months after this, basically follow up the next month. Click the right. Pwede ba yan?
Playhouse.
No, yung isa pa. Ano pa isa yan? Yan. And a few months after the next school year, from SPED, he's now in regular school. Wow! I said, wow. The mother was so happy. The parents were so happy they bought a lot of dietary nucleotides. The only thing, I need to talk to them again. The only thing is they're so far away. They're illegal. So next slide, I think that's the last. So this one is an audio file. There's a small audio file because this one is in CDO 1998. We do this. Can you click the audio button?
Good morning po. This is an interview, Immurogen interview for autistic children.
I'm the grandmother of an autistic child. Ang masasabi ko lang, nung nag-take siya ng Immuridine. Before she's taking the Immuridine, panay siyang iyak, tapos ayaw niya karoon ng mga activities. And she doesn't have fixed comprehension. Pero after that, siguro mga 2 months nag-take siya, malaki na ang improvement. So she can comprehend now, and she does the activities, and she's not crying all the time. And that's all.
Thank you, ma'am. Thank you, ma'am.
So this is Sean. Thank you very much for listening. I hope you learned something. I hope you share what you learned. And let's give the parents who have autistic child a big warm of applause. And the teachers as well. Thank you guys. You are my heroes. I can answer some of your questions if you do have questions. Yes, ma'am.
Ako po ay isang mother na yung anak ko may mga certain behaviors na katulad ng nakita kanina. But hindi ko pa siya kumbaga napapa-assess sa doktor. Doon nang nagkasakit kasi siya, naka-SGS kasi siya due to phenytoin kasi nagka-seizure siya. So meron kasing nakikita sila na parang certain behavior as ASD. Ang tanong ko lang kasi kanina mayroon doon yung sinabi mo regarding sa gamot ata yun or some medication. Kasi nang pinag-dentist ko siya, meron kasi akong condition na nag-spotting ako. So, yung parang ano yan siya, Dupaston ata yun. Nakaka-affect ba yun during the pregnancy or hindi po?
The Dupaston, we use that for arresting premature labor. So that's normal, okay siya. And important to understand that the brain development occurs during the first 3 months. So any medication during the first 3 months is the one responsible for causing problems with brain development and other conditions in the child. Ang sinasabi ko kanina is the antidepressant. So, pag minom na kasi mayroon mga conditions like nagiging depression mother, we call it either pregnancy depression. No? They give antidepressants, tapos yung antidepressants the one that affected the child. So now, we do not give anything during the first 3 months. So, yung Dupaston is okay. It's not the reason why you had it.
Just this June, my son experienced seizures na wala po siyang fever. So, have been sent to the hospital. Kaya binigyan siya ng anticonvulsant po. So, na-notice ko po na yung behavior niya, palagi siyang sleepy. Tapos, nagkakaroon siya ng something behavior na parang sabi ko uncertain na hindi at saka unusual para sa amin. So, after that, nagkaroon siya ng sakit na parang nagkaroon siya ng rashes that I thought that was measles, all the while SGS na pala. So, after that, they stopped the phenytoin kasi sabi nila that was the cause. That's why I've been thinking that di kaya yun nakapag-add-on sa behavior ng bata yung nainom niyang phenytoin?
Well, it could be because there are a lot of things that could, we call this the epigenetic factors. The factors that are beyond the gene na-expose yung bata like medication, phenytoin, diseases, infection, fever, benign febrile convulsions, those are the epigenetic factors na could aggravate or precipitate or push the, kunyari, mild pa lang siya, mild autistic, naging severe na siya dahil sa mga nadagdag ba. Kumbaga,
parang sugat siya. Sugat, kasi kinamot mo ng kinamot, this is the epigenetic factor. And that wound will not heal and will become severely infected potentially. Right? It becomes more severe. Yeah. So, maaari. Okay. Need po ba ipa-evaluate muna ang bata para makapag-take ng Immurogen? Well, actually, because one of the things that is potentially a problem for us when we did the study, is that the evaluation of the developmental pediatrician. I don't know if you had that problem as well, that for you to see a developmental pediatrician, sometimes you take 3 months to 6 months to set an appointment for the developmental pediatrician to see your child. Ang tagal. So there is no actual need for, ideally we do that. That's the idea. But if you really want improvement already, you can take the dietary nucleotide Immurogen immediately without any consultation, and you yourselves can evaluate. This is not medicine, okay? This is food. This is food for your DNA. Meaning, this is the good food, which are the nucleotides that are the one responsible for your DNA to be able to produce more normal new DNA. So, kasi for example, for your cell to be able to duplicate, kung nasira yung cell mo, like for example sa brain, nasira yung brain cell mo, dapat palitan yung nasira. Okay? We have to change the damaged brain cells, right? To be able to do that is that we have to duplicate a normal brain cell. Replicate, 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 replicate. For the normal brain cell to be replicated, the first thing it has to do is to duplicate its DNA. So one brain cell will become 2 brain cells, which has duplicate DNA, but the duplicate DNA needs nucleotides in them. And Immurogen is the only product in the market right now that has dietary nucleotides. It is food for your DNA. So it's not synthetic, it's normal. It takes 90 days of enzymatic disintegration process to make 1 bottle of Immurogen. That is why it is proprietary. Nobody else is able to do it except for the discoverers who are in Czechoslovakia. They knew about these dietary nucleotides way back in the 1950s. Bakit hindi natin alam? Because they are communists. Czechoslovakia was communist then. We are Western. So the communists will not teach the Western people what they know. So the only thing we knew then is that they were doing differently what the Western doctors were doing. They were doing differently as they approached patients with cancer. The West was treating it with chemotherapy while they were treating it at the cellular level, molecular level. So what I'm trying to say is that for one cell, regardless of what cell it is, to become 2 cells, you need 6 billion nucleotides. So 1 cell becomes 2, 2 becomes 4, 4 becomes 8, 8 becomes 16, 16 becomes 32, 32 becomes 64, 64 becomes 128, 128 becomes 256, parang cellphone, 256 becomes 512, 512 becomes 1024, and so on and so forth until you make millions and billions of cells. Imagine if this is a brain cell, so you make millions and millions of brain cells. Imagine if this is a kidney cell, make millions and millions of brain cells. Imagine this is an immune system cell that fights bacteria, viruses, and fungus. So your immune system cells can make millions and billions of immune system cells. That is why if your immune system cell, you have lots of immune system cells, you are stronger in terms of your immunity compared to one who is not taking or does not have a lot of defenders in their body. It's plain and simple. If you have the right materials, you will make and manufacture the right cells. If you have the right materials, you will make and manufacture good, strong cells. Not cells that will last for 1 week, not cells that will last for a few days, but cells that will last longer. You want that, diba? No, you do not want that. No, because you will get well. You will not get sick anymore. Then I will not make money.
It's for with autism lang po ba?
No, actually, what I'm trying to tell you is that there are things that could be addressed by improving the number of cells. Okay? I hope you understand is that if may nasira, if there is something that's damaged, may nasira, papalitan, right? If you, in a house, your house, the door handle of the house got damaged. So what will you replace? The door handle, right? Correct? Binagyo yung bahay nyo. There was a typhoon. Your roof got blown out. What will you use? Roofing materials, right? You need the roofing materials. The same thing with our body. Our body gets damaged every day. A cell gets damaged every day. What particularly in cell? In the Nobel Prize for Chemistry in 2015, they say that the DNA, particularly the nucleotides, are getting damaged every day. And these nucleotides that are damaged every day are replaced every day by repair mechanisms, but the repair mechanisms needs materials to repair the damaged nucleotides. Nasira ang bubong materials para sa bubong ang kailangan. You do not need vitamin C, you do not need coffee, you do not need any other herbal supplements. You need the exact materials. You cannot use a door for your bubong. Right? Can you use the door for your roof?
Excuse me, Doc Mario.
Yes.
Sir Leon is listening and he's writing in the chat box. And she would like to answer some of the questions.
Okay, let's go talk to Sir Leon.
At the same time, I would like to show the one-page presentation so other people would understand what Immurogen is all about. So, Sir Leon, can you unmute, sir? We're not hearing you, sir.
Maybe while Sir Leon is trying to get unmuted,
Yes.
I can just explain this one-page presentation, okay? The body are made up of different organs, right? We have the brain, the liver, the kidney, etc., etc. And those organs are made out of specific tissue. We have brain tissue for the brain, liver tissue for the liver. And those tissues are made out of specific cells. Cells for brain, for the brain cell, brain cells for the brain tissue for the brain. So the cells, once you get it, inside you have the center part called the nucleus. Inside of the nucleus, when you open it up, you have the chromosome. You have 43 chromosomes, 23 from your mother, 46 chromosomes, 23 from your mother, 23 from your father. That is exactly the reason why you look like your mother or you look like your father, and you do not look like your neighbor. Because it's the genes of your mother and your father, not the genes of the neighbor, except, so inside of the nucleus, we have the chromosomes. You get one chromosome, you stretch it, it is called the DNA, deoxyribonucleic acid. And the materials for the deoxyribonucleic acid, the building blocks are called the nucleotides. All right? And the Immurogen only contains nucleotides and proteins that are natural, coming from natural processes of extracting it is not synthetic, there are no synthetic products. Sir Leon, are you able to add some more?
Actually, part of the program is to interview again Ma'am Reza. And I've just prepared a video recording The Crying Lady. It's titled The Crying Lady. So how it all started for what all this.
The good news is she's crying with happiness now. Look at that smile. I'm so happy for you.
Kami nagdamala sa namin na dalawang lalaki na puro special child. Ang pinaka-worst po yung anak kong panganay dahil sa buntis pa lang ako hanggang pinanganak ko siya, hanggang sa lumaki siya, parang nabuhay po siya sa gamot. At siyempre po paggamot, pera po. Grabe pong sacrifice namin. Kahanap kami ng kung ano-anong gamot. Parang nagiging baliw po ako sa paghanap ng gamot para sa anak ko. Mayroon po akong tatakbo sa Manila kung ano-ano pong gagawin ko. Para lang po sa kanya dahil lagi po siya nagtatantrums. Kinakagat niya kami, sinusuntok. Yung mga kapatid niya parang mga nagtatakbuhan pag nagagalit na siya, nagtatago sa aparador, sa ilalim ng lamisa, sa kama. Nagiging ano na rin po yung buhay ng mga anak ko dahil sa kuya nila. So, nung 2015 po, na hospital po siya. Nakatali po siya sa ospital ng halos 1 month dahil po nagwawala siya, sinisira yung mga gamit. Tapos nung last year po, March din po siya na ospital. Halos 1 month din po kami sa ospital, nakatali pa din po siya dahil nananakit po siya, halos pati doktor, mga nurse. Tapos po, parang hopeless na po ako, lagi po ako umiiyak. Tapos po, ang brother-in-law ko po, may nabanggit po siya sa amin na sabi niya, itry daw po namin kay Joris. Baka daw po umipikto sa kanya kasi sabi niya, naghahanap tayo ng makagamot sa kanya. Baka ito na po yun. So that time po, wala kami pera kasi kalalabas lang namin sa ospital, malaki pong gastos namin. So ang ginawa niya po, siya po yung nag-finance, pinadala niya po sa amin. Tapos, pinainom po namin siya pagdating ng gamot. In 3 days po, nakapahinga po kami ni Papa niya. Nakakatulog po kami kasi hindi po siya natutulog sa gabi. Tapos pag kami po tulog, ginigising niya po kami, kinakagat, sinusuntok para po samahan namin siya. Pero after 3 days po na uminom siya ng Imerogen, nakapahinga po kami ni Papa nila. Yung napaluwa ka sa kaligayahan na may nagbago in 3 days lang na uminom siya noon. Sabi ko sa Papa niya, sa tagal-tagal natin na naghanap ng gamot na para sa anak natin, bakit ngayon lang ito dumating? Marami yung sakripisyo talaga. Lalo na po ako, ang dinanas ko po, sobra-sobra po talaga yung nawala na po ako sa sarili ko. Pati po yung mga anak ko naapektuhan na po, napapabaya ko na sila kasi yung naiawa po ako sa sarili ko dahil nakapokus na po yung sarili ko sa kanya, yung wala na ako pagmamahal sa sarili ko, siya na lang po, lagi na lang po, para po gusto ko yung pagdating na araw mawala siya sa akin, magsisip ako. Kaya po, sabi ko kay Jojo, bakit ngayon siya dumating? Sana kung naagapan natin si Joris noon, baka malaki pong nagbago sa kanya. Kasi ngayon po, active po siya, nag-ano na po siya sa bahay. Lagi po siya nagwawalis. At the same time po, Joris po, may pinanganak po, ang sakit niya is kidney, atay, baga po. Nagsabay-sabay po yun. Tapos tumaas po yung sugar niya. Umiihi siya ng dugo. Marami po talaga. Sa sakripisyo ko po, lagi naman po ako nagpapasalamat sa Diyos. Lalo na po sa dumating na ano na yan, ang Imerogen sa buhay namin. Kahit hindi po namin siya napapainom araw-araw dahil siyempre po, kapos din po. Pero hindi po nagbabago yung ano niya. Pag may pera po kami, bumibili po kami. Na-introduce ko na rin po sa iba. Sa mga nanay din po na at alam niyo po na ako din po, gusto ko rin po mag-inom ng ganun kasi marami po akong naramdaman. Grabe po talaga. Salamat po sa Imurigin. Kung wala po ito, hindi po nabago ang buhay namin. Hindi po kami naging masaya mag-asawa. Hindi po magiging normal ang buhay ng isa kong anak na babae kasi po sobra po talaga yung depression po ng anak ko. Na-depress na po yung bunso kong anak na babae dahil si kuya niya po pag nag-tantrums po, lahat po sa bahay. Wala po kami gamit. Pati po upuan, ginaganon niya. Kahit bagong lamisa, ihagis niya. Kaya mula nung nagpasalamat din po yung anak ko na, Mama, sana noon pa dumating na to sa buhay natin ang gamot para nagamot na si Kuya at saka si Kuya ko si Direk. Kasi dalawa po yung anak namin na gano'n. Salamat po. Salamat po sa inyo. Salamat po.
Hello, good afternoon. Okay na po ang... Pinaiyak nyo kasi ako, binalikan nyo yung nakaraan ko. I-share ko sa inyo ang ano namin ngayon buhay. Ang tahimik na, medyo may sigaw si Jores, pero na-enjoy talaga namin ngayon. Enjoy kami. Halos araw-araw po, nagpupunta po kami sa dagat, naliligo po kami, na-enjoy na namin yung noong ilang years na hindi namin napupuntahan yung dagat kasi ayaw ni Jory sa buhangin, ayaw niya sa alon, ayaw niya sa tubig. Takot siya sa tubig, marami siyang kinatatakutan. Pero ngayon, nung bago magbukas ang klase, halos araw-araw sa umaga nagdadagat kami, pumupunta kami sa beach. Sa gabi or sa hapon pumupunta din kami sa beach. Na-enjoy na namin yung buhay namin. Kasi noon hindi namin naranasan 'yan, hindi ko naranasan noon na naging masaya. Yung parang malaya ka, umalis. Noon hindi ko naranasan 'yun. Ngayon, hindi na ako nag-alala na pag umalis ako isang linggo si Jores magwawala, mananakit siya. Hindi na po, as kampante po yung sarili ko, naiwanan ko siya kahit kalahating buwan sa kapatid niya. Hindi siya mananakit, tahimik lang siya, basta pakainin lang siya. Ang tulog ni Jores ngayon, 8 hours, 7 hours. Yun lang kasi ang nakapattern sa kanya. Kaya pag naka 8 hours na siya or 7 hours, magigising na siya. Yun ang nagiging minsan kasi madaling araw nagigising na siya. Pero kompleto po yung 8 hours or 7 hours na tulog niya. So okay na rin yun.
Ano ang mag-a-advise po ngayon sa mga nakikinig sa iyo ngayon, especially the mothers na mayroong mga autistic children? Ano may advice mo?
Ang ma-advise ko sa inyo, kung bata pa po yung anak niyo, mas maganda po bata pa, mag-umpisa na kayo. Huwag po kayong maghinayang kasi malaki po yung magiging improvement ng anak niyo kung bata pa. Kasi hindi katulad ni Joris, nag-umpisa kami, 19 years old na siya eh. 19 years old na siya. So, si Joris kasi, severe autism siya, non-verbal, as in yung kanyang brain, ang paliwanag sa amin sa St. Luke's, hindi nag-growth ang brain ni Joris. Pero ngayon, si Joris, pag hindi niya nakita si papa niya ng 2 days, pag nakakita siya ng mga lalaki sa labas ng bahay namin o magpunta kami ng kalsada, maggala, tinatanong niya, kumbaga tinatanong yung ang tao, Papa, talagang sinasabi niya Papa, nagtatawanan nga yung mga tao kasi sabi niya, tinawag niya ako na Papa. Sabi ko, hindi, tinatanong niya si Papa niya. Yun. Kita mo yung yung pag nawala si Papa niya, ihahanapin niya. Nakakaano yun kasi madalang si Joris magganon eh. Noon, hindi nga siya nagtatawag ng mama, papa eh. Ngayon, ang sarap pakinggan ng ma, pa, ate. Yun ang nasasabi niya. Tapos sa bahay, pag may kalat, walis siya ng walis. Nagliligpit ng pinggan. Kasi sila naman kasi, autism sila, hindi mo yun maiwasan yung tantrum. But hindi po yung tantrum na noon na gumugulong-gulong sa kalsada si Joris. Hindi. Nangangagat, nananakit. Hindi. Pag sinabi mo na stand up, hilain mo lang siya, tapos parang, ano mo lang, pag nagsalita ka, kalma ka lang, okay na. Kung ang Immuregene noon, bata pa si Joris, mayroon ng Immuregene, posible na malaki ang naano ni Joris, na improve. Malaki po ang na-improve kasi ngayon nga nag-i-improve siya eh. So sa mga parents na may mga anak na may bata pa, ang advice ko sa inyo is mas maaga, mas maganda. Huwag po tayong maghinayang na ano kasi naghahanap tayo ng cure eh. Hindi naman siya cure pero nakakatulong siya. Malaki ang maitulong niya. Kasi wala naman talaga cure ang autism eh. Wala. Pero ang Immuregene malaki yung natulong sa amin. Kaya sa mga parents, kung gusto nyo magtanong sa akin, okay lang, welcome po. Kasi may experience na ako sa kanila eh. Tungkol dyan. Kaya umpisahan nyo na po. Huwag po kayong maghinayang. Kasi para din yun sa anak natin. Kasi iba nagre-reklamo, nagtatantrum, bayulinti yung anak nila. Yung anak ko, bayulinti siya. As in. Ilang years ako umiiyak. Hindi ako nakakatulog. 19 years nang dumating ang Immuregene sa buhay namin. Hindi kami nakakatulog. Ngumingiti ka lang sa labas. Pero dito, deep inside, grabe talaga ang ano mo sa loob. Parang gusto mo nang sumabog. Pero ngayon, wala na. Kung tutulog ako sa tanghali, nandyan lang si Joris. Nakakatulog na ako sa tanghali. Talaga, totoo yan. Nakakatulog na kami sa tanghali. Kaya, thankful po ako sa...
Maraming salamat po. Again, ang atin is actually makatulong doon po sa...
Yes.
Doon sa mga ano kasi hindi nga biro no yung dinadanas ng family pagka meron tayo mga cases sa kanila. Yung ako nga meron ako special childhood po ganun yung eldest ko. So alam ko nakaka-relate po tayo ito. Okay? So maraming salamat Ma'am Reza.
Thank you, thank you.
Magpapasalamat na po ako. Maraming salamat sa oras niyo and I hope we did not waste your time today. Doon po sa Zoom, nandun na po yung email, nandun na rin po yung mga contact numbers yung kung may mga katanungan po kayo. No? And meron rin po tayo daily, we have alternate po sila, Dr. Mario, Dr. Arlie, they're here at the office, they give free medical consultations. Punta lang po kayo dito. Okay? Okay? So, doon po sa Zoom, maraming salamat po sa oras po ninyo. Thank you po sa inyo lahat. God bless.